Hey there, science fans! Today we're diving into the fascinating world of X-rays. These invisible beams have revolutionized medical imaging, allowing us to see inside the human body without surgery. But what exactly are X-rays? X-rays are a type of electromagnetic radiation, just like visible light and radio waves. But here's the catch. X-rays have much higher energy than light. This high energy allows them to pass through objects that light cannot, like our bodies. Think of it like this. Imagine shining a flashlight through your hand. The light won't pass through. Now imagine a super-powered beam that can penetrate your skin, muscles, and even bones. That's the power of X-rays. So, how do we generate these powerful beams? Let's take a closer look at the amazing device that makes it all possible, the X-ray tube. Get ready for some electrifying science. The X-ray tube is where the magic happens, folks. It's a specialized vacuum tube that produces X-rays through a series of clever steps. Picture this: a glass tube, shaped somewhat like a light bulb, with two crucial components inside, the cathode and the anode. The cathode is the negative terminal. It's a heated filament, kind of like the one in a traditional light bulb. This filament, when heated, releases electrons. Think of these electrons as tiny energy packets, ready to be launched. On the other side of the tube, we have the anode, the positive terminal. It's a metal target, often made of tungsten. Tungsten is a very dense metal with a high melting point, which is essential for this process. Now, remember those electrons we talked about? They're about to take a high-speed journey from the cathode to the anode. And when they hit the anode, something incredible happens. Stay tuned to find out how this collision creates the X-rays we use in medical imaging. Here's where the real action begins. A high voltage creates a strong electric field between the cathode and the anode. Electrons are pulled at lightning speed towards the anode. They gain tremendous energy as they zip across the tube. When they slam into the tungsten anode, they interact with its atoms. This interaction is the key to X-ray production. There are two main ways X-rays are generated. The first is Bremsstrahlung radiation, or braking radiation. It happens when electrons are suddenly slowed down near the nucleus. This releases energy as X-rays. The second is characteristic radiation. A high-energy electron knocks out an inner shell electron. When an outer shell electron fills this vacancy, energy is released as an X-ray photon. So there you have it. The collision of high-speed electrons with the tungsten anode generates the X-rays we need for medical imaging. Once generated, X-rays are emitted from the tube in all directions. But don't worry, the X-ray machine is designed to control this emission. A lead housing surrounds the tube, with a small window that allows a controlled beam of X-rays to exit. This beam is what we use to create images of the inside of the body. The object or the patient is positioned between the X-ray source and an X-ray detector, which is like a special photographic plate. As the X-ray beam passes through the body, it encounters different tissues and structures. Here's where things get interesting. Different tissues absorb X-rays to varying degrees. Bones, being dense, absorb more X-rays than soft tissues like skin or muscles. This differential absorption is what creates the contrast in an X-ray image. Areas where more X-rays pass through appear darker on the image, while areas where X-rays are absorbed appear lighter. But how are these variations captured and transformed into a visible image? Let's find out. Section 5. Positioning and exposure. Key factors in X-ray imaging. Getting a clear and informative X-ray image relies on two crucial factors: proper positioning and accurate exposure. Think of it like taking a photograph. You want your subject to be in focus and well lit. Positioning is essential in X-ray imaging. The patient or the body part being examined needs to be carefully aligned with the X-ray beam and the detector. The goal is to ensure that the X-rays pass through the targeted area at the correct angle to capture the desired anatomical structures. Exposure, on the other hand, refers to the amount of radiation that reaches the detector. It's like controlling the shutter speed on a camera. Too little exposure and the image will be too dark and lack detail. Too much exposure and the image will be overexposed, washing out important information. The duration of exposure, measured in milliseconds, is carefully controlled to achieve the right balance. Modern X-ray machines have sophisticated systems that automatically adjust exposure settings based on the patient's size and the body part being imaged. Section 6. Detecting the unseen: how X-ray images are formed. Now let's talk about how those invisible X-rays are transformed into images we can actually see. Remember the X-ray detector we mentioned earlier? It's the hero of this story. In the past, X-ray images were captured on photographic film. The film was sensitive to X-rays, and the varying degrees of exposure created a latent image that was then developed chemically, much like developing a traditional photograph. Today, most X-ray systems use digital detectors. These detectors convert X-ray energy directly into electrical signals. These signals are then processed by a computer to create a digital X-ray image, which can be viewed on a monitor, printed, or stored electronically. Digital X-ray imaging has several advantages over traditional film-based methods. Digital images are available almost instantly, allowing for quicker diagnoses. They can also be enhanced and manipulated using computer software to highlight specific details or adjust contrast, providing more information to the radiologist. Section 7. Conventional radiography, a cornerstone of medical imaging. Now that we understand the basics of X-ray production and imaging, let's explore some of the remarkable ways X-rays are used in medicine. First up, we have conventional radiography, the most common type of X-ray examination. Conventional radiography is what most people think of when they hear the term X-ray. It's used to diagnose a wide range of conditions from bone fractures and pneumonia to arthritis and kidney stones. It's also used to guide medical procedures, such as setting broken bones or inserting catheters. The process is relatively simple. The patient is positioned between the X-ray tube and the detector. The X-ray beam passes through the body, and the detector captures the image. The resulting image shows a two-dimensional representation of the internal structures, with denser structures appearing whiter and less dense structures appearing darker. Conventional radiography is a valuable tool in medical imaging due to its availability, affordability, and ability to provide quick and often crucial information about a patient's condition. Section 8. Fluoroscopy, X-rays in motion. While conventional radiography provides static images, fluoroscopy takes X-ray imaging to the next level by allowing us to see moving images in real time. It's like watching a live X-ray video. In fluoroscopy, a continuous X-ray beam is used and the images are displayed on a fluorescent screen or a monitor. This allows doctors to observe the movement of internal organs and structures as they happen. Fluoroscopy is used in a variety of medical procedures, including barium X-rays, where patients swallow a contrast agent containing barium, which makes the digestive tract visible under X-ray. This allows doctors to evaluate swallowing function and identify problems like ulcers or blockages. Cardiac catheterization, where a catheter is inserted into a blood vessel and guided to the heart using fluoroscopic guidance. This procedure helps diagnose and treat heart conditions. Joint injections, where fluoroscopy guides the precise injection of medications into joints to treat pain and inflammation. Fluoroscopy provides valuable information about dynamic processes within the body, making it an essential tool for diagnosis and treatment. Section 9. CT scans. Building 3D images from X-rays. Computed tomography, or CT scanning, takes X-ray imaging to a whole new dimension, literally. CT scans use X-rays to create detailed cross-sectional images, like slices of bread, which can be combined to form a three-dimensional image. The patient lies on a table that moves through a donut-shaped scanner. The X-ray tube and detector rotate around the patient, taking multiple X-ray images. A computer combines these images to create detailed cross-sectional images. These slices can be stacked to create a 3D reconstruction. CT scans can detect tumors, fractures, and infections. CT scanning has revolutionized medical imaging with unprecedented detail and accuracy. Section 10. Specialized X-ray techniques: mammography, dental radiography, and angiography. In addition to conventional radiography, fluoroscopy, and CT scanning, there are several specialized X-ray techniques that play crucial roles in specific areas of medicine. Let's take a closer look at 3 of these techniques. Mammography. This specialized X-ray technique uses low-dose X-rays to image the breasts. It's a vital tool for early breast cancer detection, even before a lump can be felt. Dental radiography. We've all experienced these X-rays at the dentist's office. Dental X-rays use very small doses of radiation to capture images of teeth and surrounding tissues. They help dentists diagnose cavities, impacted teeth, bone loss, and other dental problems. Angiography. This technique uses X-rays and a contrast agent to visualize blood vessels. A catheter is inserted into a blood vessel, and a contrast dye is injected. X-ray images are then taken as the dye travels through the blood vessels. Angiography is used to diagnose and treat conditions affecting blood vessels such as blockages, aneurysms, and blood clots. These specialized X-ray techniques demonstrate the incredible versatility and power of X-rays in medical imaging, allowing us to see inside the human body with remarkable detail and precision.